Hi there YouTube, it's Karen, or Shrinking Goofball. I'm going to try and do this again. I just went into the kitchen to upload this and I erased the 3 that I did before because I had my son calling my name or whatever, and I erased the good one. So, and the other one that I just did, I was like, God, you ramble, Karen. Anyway, as you can see, I'm outside. I'm enjoying this fantastic weather. I think it hit, I don't know, I think the Weather Network said 20, but it definitely felt warmer than 20. I'm wearing a tank top, as you can see. Not something I would normally wear outside. I didn't wear it like out and about. I know apparently us Canadians are made fun of for saying out and about. But because of that, the Miami wave. So this part of my arm is normal. And then I've got all this extra skin down here. And no, don't worry, I won't show you anything else with extra skin. Not yet anyway. So let's get started with my numbers. I am on week 25, post-op week 25. On October the 17th, I started my Optivast diet at 321 pounds. I did that diet for 3 weeks. I lost 24 pounds. On November the 7th, I went in for my gastric bypass at 297. Last week, I reported that I was 215 pounds. Today, I'm 213 pounds. That's a 2-pound loss for a total of 108 pounds. I have never, ever lost more than like 65 pounds doing a diet. I hate the word diet now, but I think the last time I did anything that really made me lose was the Atkins diet, you know, low carb, high fat, have a heart attack, but at least lose the weight. So yeah, losing 108 to me is just, it's mind-boggling. Yeah, so I've never even had to go out and change my clothing as much as I have now, you know. I'm not complaining. I love it. So yeah, today I'm wearing a tank top because when I went inside, it was pretty warm. And I said I'm going to go and I'm going to sit in the sun and I'm going to do my video outside. Right now I'm sitting underneath a pine cone. The reflection of the sun was just too much. So I'll get this video done for us and get it loaded. Yeah, so let's talk about my ulcer medication. Something that I've never had before, an ulcer. Obviously got it because of my surgery. There is a reason why, because after you have a gastric bypass, you're supposed to take medication for ulcers. And the very first month, I didn't take them at all. And that's because when you go home with a script with the medications from the hospital that you're supposed to take, one of them was my all the needles that I had to put in my stomach. I think it's a blood thinner. Flies. And then the other one was, oh shoot, they tickle. Like, I don't mind them, but they just tickle. Yeah, and the other medication for not getting ulcers. So I kind of panicked, got the medication, and I think at that point I was already with an ulcer. And then I neglected the medication. So for those of you out there that think they can get away with not taking the medication, they probably won't get an ulcer. You might get an ulcer, so don't take that chance. So a couple of videos ago, I do believe I showed you the picture of my ulcer, quite a bit of blood in there. I've never brought up blood. I've never spit up blood, but there is blood in there. He showed me where the ulcer is. So medication for another month, just until like the end of May. And then I was told to introduce my solids a month into it. So I'm on about, yeah, week 5 today. And I've started my chili from Wendy's, loaded with proteins. I'm happy about that. I can do my Rice Krispies. I just let them get a bit soggy. So I kind of feel like I'm starting from, you know, fresh again and a little bit scared, you know. I shouldn't say I'm scared. I don't know how to word it. It's just, you know, as flies, hold on. As used to throwing up as I am, I don't enjoy it. The funny thing, as gross as this sounds, is that I remember being sick as a child and, you know, just feeling so nauseous. You'd either wish you'd throw up or just feel better. And this type of sickness, this feeling sick to the stomach that I have now, is very different because, you know all the rules. You eat really slow, you don't eat too much, and you eat a small amount, maybe 4 ounces, you know, whatever you're eating. And you just know if you're going to throw up. You can feel it. And it doesn't take forever. It happens quite quickly. And as disgusting as this sounds, it comes up tasting exactly the same way as it goes down. So it's not half as disgusting as when you're, sick. Because it doesn't sit in your stomach with all, the acids and stuff in your stomach. So yeah, so that's the disgusting part. It's done. But I'm not really throwing up anymore. I'm just taking it really easy. I really do still need to take my protein shakes, not having enough of those. I kind of got tired of them, and I was glad to be getting my protein from food sources, so I still need to take those. And the ulcer medication I'm probably going to have to take for an extra 5 days, because the ulcer medication in particular, because I have to take Prevacid, which is to reduce acid, as well as the ulcer medication. And I have to take it 4 times a day. And it's kind of hard to squeeze, like I'm taking 10 pills right now a day, including my vitamins and minerals, my extra iron, because my iron's low, my D is low, so I take that in a dropper form. I'm on pain medication, I'm on all kinds of stuff. So the ulcer medication has to be taken on an empty stomach. It has to be taken 2 hours away from calcium. Yeah, so when there's other medications that you have to take, and they sometimes have to be taken away from the calcium, because calcium, they just won't be absorbed. So it's tough sometimes. So I'm doing my best, really. The other thing really I'm noticing again is the whole clothing. I remember the first few times I lost a big deal of, a big amount of weight. It was all about, you drop 10, 15 pounds, and that's like dropping a dress size. My pants now, sorry about the movement, but my elbows are getting sore. It's like dropping a dress size. So my pants are a 16. I'm just wearing like a large tank top. Most of my clothes are, like the tops are a large, extra large. And I don't want to hide anymore. So I don't want to be wearing big baggy clothes. The other thing is, I have a couple of pairs of capris. And when I go away at the end of June, Wisconsin, probably very similar weather to what we have here. So, I'll probably be bringing my capris, so I'm really hoping that they're not too big. I think that's it. It's been a really good week, just weather-wise, and just being content and happy, and, I think part of, more flies. The thrill for me is, I've never did this before, and maybe it's because I'm just older and appreciating, how hard it was over the last 20 some odd years, to lose weight and gain it and gain more, and now here I am with gastric bypass. But, I go in my son's room because he has a full-length mirror, and I just look at myself, and, it sounds vain, but, I think it's like you need a new appreciation. You need to look at yourself and say, damn, I look good, and, another 20 pounds or 30 or 40 or whatever it is you have to lose, it's like, I look good. And it can't just be about, getting into a 16 and fitting into it. It has to be looking at yourself and saying, I look really good. So, I'm trying to do that at least once a day, if not more often. I don't mind having my picture taken. Even doing these videos, I look back and say, before my surgery, I never would have been comfortable with a camera, or, I'm normally the one taking the picture, taking the video, so it's a very cool feeling. So I just want to send a little shout out to Angela. Hope you're not getting too much sun. Make sure you're protecting that delicate skin of yours. And I guess, what are we, wait, just May and June, 2 more months. Sounds so far away, but I know you always look forward to the videos. It'd be nice if you made a YouTube channel, and then you can make videos, and then I can watch you. So anyway, Angela, I hope you're having a great time. You guys have yourself a fantastic week, and I will see you on Wednesday. Take care, YouTube.